Since your child's air is entering through the trach and not their mouth or nose, they are bypassing the body's natural filtering and humidifying system. There are two main devices that have been designed to help compensate for this deficiency. The first is called the thermovent, also nicknamed a Swedish or artificial nose. This plastic, barrel-shaped device slides onto the end of your child's trach. It has a filter on the end to prevent contaminants from entering your child's airway. The thermovent has two main designs: a single filter design for infants that shoots straight out from your child's trach, and a double filter design that runs horizontally across your child's throat. Each nose is designed to both filter air and capture moisture from your child's breathing. This helps keep the throat warm and moist and helps prevent mucus plugs from forming. If the thermovent is too wet or your child has coughed up secretions into it, replace it with a new one. The thermovent is not designed for 24-hour-a-day use. It is designed primarily for daytime hours and should be replaced daily. The other device we will discuss is the air compressor. This mechanical device is typically used overnight or during naps and is designed to provide a continuous stream of cool moisture to keep your child's secretions thin and their trach plug-free. The compressor nebulizes sterile water, which then passes through aerosol tubing. The aerosol tubing runs to a mist collar, also known as a trach mask, and is placed over your child's trach. In the middle of the tubing, there is a plastic bag that captures excess moisture that forms along the length of the tubing over time. The compressor delivers a continuous stream of moisture and can be adjusted for both air pressure and the amount of moisture desired. It is recommended that you change the sterile water every day, and that you replace the aerosol tubing, trach mask, plastic bag, and sterile water container once a week to prevent bacteria buildup. If your child has been sick, or if you feel it is appropriate, you can clean the trach mask more often using half-strength peroxide or vinegar water. While the air compressor does deliver a continuous stream of cool, moist, nebulized air to your child, it is not the best option since the solid water particles that make up the mist have the potential to spread infection. A better option, if available to you, is to use what is known as heated or active humidification. During heated humidification, shown here as part of a BiPAP system, sterile water is held in a clear plastic container that is placed over a heating plate. When the water evaporates, the vapor is blown through the tubing toward your child's trach. The benefit of this system is that it more closely reflects the body's own humidifying system, plus water vapor is not capable of carrying the contaminant particle matter that a cool mist system can. In the event your child is not getting the proper amount of oxygen, an oxygen concentrator may be ordered by your physician. The concentrator will produce pressurized oxygen, which can then be delivered into the aerosol tubing via a plastic adapter. For Elizabeth, we supplement about 1.5 to 2 liters of oxygen when she needs it. You don't want to provide an excess amount of oxygen, just enough to keep her SATs at the proper level. At first, the sound of the air compressor and oxygen concentrator may seem loud, and you will question whether or not you will be able to sleep with them running. But in time, they will just seem like background noise, and you will hardly be aware of them at all. By utilizing the air compressor, humidifier, and oxygen concentrator, you will help improve your child's comfort, reduce the risk of infection, and minimize the amount of plugs that may form in the trach.